Okay, we are live.
Yeah, good evening, everyone. I welcome all of you to this 90th masterclass. I think this is one of the milestones that we have achieved doing 90 classes on fertility. And today's topic is quite an interesting one. This is on ERA. So much has been spoken about the embryo for so long that we forget that the counterpart, that is the endometrium, is equally important when we talk about implantation. And I think the embryo has received enough and more attention from all of us, talking about day 3, day 5, PGTA and ICS and all those things. So today is the day that when we will be talking more in detail about the not just the morphological aspect of the endometrium, but more at a molecular level. And I think this is one of those tests which is available now, which I think is in the a la carte kind of a menu where people kind of pick and choose, and many patients themselves ask after failed cycles that whether this is something they should actually try and do it. So we'll get an insight practically as to whether it is relevant in the present situation, especially in our kind of population, and also in the way that we practice fertility in India. Over to you, Dr. Jay.
Okay. So I want to make one disclaimer that ERA is not a test which we have been doing a lot in the last 1 to 2 years. Before that, we were doing a lot of ERA test, approximately 3 to 5 in a month. Okay. And now it has gone down to approximately 1 to 2 in a month, not more than that. Okay. Sometimes just one in a month. The reason why it has gone down is because it has been our observation that ERA does not really help in addition of success rates irrespective of the window. Okay, what it tries to predict. But I'm going to give you a logical explanation as to why you should consider to do a particular test or why you should not consider to do a particular test. Okay, so before that, let me just tell you simply, ERA is endometrial receptivity array. Don't apply any logic. All you are supposed to do is you are supposed to prepare the endometrium like how you are going to prepare, okay, for an embryo transfer. And you are supposed to give progesterone and take the biopsy on the 5th day based on the type of embryo transfer you will be doing, which is a blastocyst transfer. All right. Once you take this biopsy is then sent in a buffered solution outside the country, most of the situations. And when it goes outside the country, then I will explain what happens in this entire process. Okay. So as a clinician, this is all that you are supposed to do. All right. So let me just start the screen sharing. Okay. You can see it, no? Shilpa madam?
Yes, yes.
So we are going to talk about endometrial receptivity. Now, let us understand, in order to understand endometrial receptivity, okay, what is actually window of implantation? Okay, we are all complaining that window of implantation, because ERA test is going to give you something called as personalized window of implantation. Okay. Now, what is window of implantation? Basically, window of implantation is that particular level where the endometrium is prepared so nicely and it is in such a good secretory phase, okay, that this secretory phase of the endometrium, when the embryo enters inside this embryo can then undergo an endometrial embryo crosstalk and can cause a successful implantation. Now, this successful implantation is actually resulting into a healthy pregnancy. Okay, so two things are important. For a healthy pregnancy, this embryo is supposed to be a euploid embryo, and you say healthy when there are no complications. Okay, this is what usually happens when it has got implanted in the perfect window of implantation. Now, normally, we do not know how much it is, but it is believed that it is going to be approximately 24 to 30 hours in a complete natural cycle. And as a result of this, when you are doing a natural cycle protocol for embryo transfer, okay, you cannot do the ERA test because you will simply not be able to decide what was the time of progesterone exposure, because you will not be able to pinpoint the time for ovulation to occur. All right. If you are doing a modified natural cycle FET preparation wherein you are giving a 10,000 hcg trigger, then I personally feel it is going to mimic the natural cycle in a very nice manner. And when it mimics the natural cycle in a very nice manner, in fact, when the ERA test is showing an abnormal result, okay, the treatment of choice is to do a modified natural cycle. All right. So ERA test is basically only going to help you in cases of an HRT cycle. Your standard HRT preparation, estradiol valerate, you have to give for, let's say, 9 days is, and then you are going to give progesterone for, let's say, 6 days, and on the sixth day you will be doing a biopsy. And this thing, your biopsy, that means this endometrium which you have taken out using a pipel biopsy, it is going to go outside the country. And you know what it does? So what is the basis of this test? I'll just tell you. A lot of people try and think that, okay, some genes are upregulated, some genes are downregulated. So, based on this genomic sequencing, some major thing is going to happen. Now, actually, in the ERA test, what is tested is the RNA. Okay. Because see, endometrium cells, suppose this is an endometrial cell, okay, what they will do is they will allow this endometrial cell to get lysed, that means disintegrated. Once the endometrial cell gets disintegrated, only RNA and DNA will remain. We don't even end up testing the DNA. In order for DNA, the genes, there are some genes which are going to be upregulated whenever it comes to doing implantation. Some genes will be upregulated, and there will be some genes who are downregulated. Okay, so the message of these genes is actually carried by the RNA. All right, and because the message is carried by the RNA, the endometrial receptivity tests the number of RNA of those particular genes. There are approximately 250 such genes, and then it is going to give you a picture. Okay, these many genes were upregulated, these many genes were downregulated. It matches best with the window of implantation, as a result of which the endometrium which you sent us was receptive. Sometimes some genes are yet to be expressed, okay, and as a result of that, this endometrium was pre-receptive. And in certain situations, the report will come that, okay, the genes have been expressed and are on their way out, so it is going to be post-receptive. Now, I don't want to go into the much details of the RNA, but just remember amplification. When the gene is getting upregulated, the reason why I've drawn 3 marks up and 3 marks down is because its concentration of the RNA will normally go up by 3 times. All right, just remember that, which is the basis of doing this entire endometrial receptivity array. It is a very simple genetic test. It is done on a simple platform. There is no rocket science. It is a machine driven test, and this machine is commonly available at many many places in India also. All right, so don't worry about it. If the answer is that the endometrium is receptive, that means your transfer timing is correct. If the answer is that it is post receptive, that means you are supposed to basically do a transfer one day early. And if it is pre-receptive, that means you are supposed to do the transfer one day late. Okay. Just remember, the normal window which is going to be mentioned is going to be approximately 110 to 120 hours. If the post-receptive window is normally going to be between 120 to 138, and this is going to be normally between 98 to 110. If it is more than 140, or if it is less than 98, then you need to do something called as a repeat biopsy. Okay, I will not get into much details of repeat biopsy. I will take a lecture specifically on that. But Please remember when to do the ERA test. Very important. ERA test to be done only and only if euploid embryo has failed to embryo transfers. Okay, so before doing the ERA test, basically you should do a PGTA. That is important. All right. Remember one thing. This PGTA tested euploid embryo can give rise to a successful implantation, but can give rise to an unhealthy pregnancy which is having preeclampsia, IUGR, all these things. It is said that preeclampsia and IUGR also occur if there is a window of implantation, but it is slightly late than what the body wanted. Okay, those are the new postulated causes for having PIH, IUGR, and all these problems in the child. All right. Same thing. Remember, window of implantation is often shifted when the patient is having endometritis. What is the most commonest cause in India? TB. It is very much shifted when the patient is having endometriosis. It is shifted when the patient is having adenomyosis. It is shifted when the patient is having recurrent implantation failures, recurrent abortions. In all these situations, the window of implantation gets shifted. So even if you have a euploid embryo in these conditions, till this condition is not corrected, there is no role of doing ERA. So basically, the other indication apart from euploid embryo is that the patient should have a normal uterus. Please remember, this presence of a normal uterus is extremely important for you to go ahead and do the ERA test. Okay. The normal cost of doing the ERA test is going to be around 45 to 50,000 rupees. The normal time for reporting is going to be around 20 days. And this is the only thing which you need to know about the reporting that is concerned. As a result of this, when the biggest problem which people experience in their ERA test and they think that the ERA test did not really help me is because they ended up doing ERA in a wrong protocol. They ended up doing the ERA test when the patient had endometriosis. You know, they ended up doing the ERA test when the patient had a history of, let's say, previous 3 abortions. Or they ended up doing the ERA test when the patient was having an adenomyotic uterus. You know, we have people who are great, means they are so meticulous and, they really give so much importance because they want to give justice to their patient that they end up doing one surgery in a day. Okay. And they don't even touch the adenomyotic uterus despite having patient failing 2 or 3 IVF cycles. Ekdam great. The uterus is left as it is, pain is as it is, patient is as it is. Okay. In all these situations, what is going to happen is your ERA test is not going to benefit you. For ERA to benefit you, the best patient is the patient with an unexplained infertility with 2 euploid embryos. Both have been tried and both have been negative. One more thing, remember, this ERA and the genetic the way in which the genes are calculated are predominantly studied and calculated on Caucasian women, on women from Europe. The Indian uterus and the European uterus is very different, very different. The reason why I'm telling this is because the type of bacterial infections which we have in Indian vagina are very different than the type of bacterial colonization of a Caucasian woman. So one thing you remember, if you don't have the money and you think, I don't know, ERA will be so effective or not, then just remember one thing. In the next cycle, do a modified natural cycle protocol and give the patient probiotics. Best. It works wonderfully well in Indian women. Don't get worried about it at all. Second, this is going to be a curtain breaker. Don't think that after you do ERA, and if the timing is I want to transfer the embryo at 114.2 hours, and if you put the embryo exactly at 114.2 hours, it is going to give your success rate 90%. That doesn't happen. Okay. After doing that, it may improve cumulative pregnancy rates. Okay. It does not do anything else. Okay. So these are the take home points. Once again, I'm repeating, it's a great thing, but please remember you can only do it on a normal uterus, provided it is a euploid embryo which you have. Okay. If you are saying my patient does not have the money to do PGTA, then don't waste your patient's money on doing ERA also. Okay. If you think that your patient has a frozen pelvis, Okay. And in a frozen pelvis, you want to do ERA? Wrong. It is not going to give you any value any which ways. Okay. Just in case somebody has an adenomyotic uterus, you are God and you decide and you think that adenomyotic uterus to be left behind as it is without correction. Remember one thing, ERA will not work. You can easily say you don't know how to correct, but correction is very important for that patient. Even after correction, ERA will not work because that is going to be then a corrected uterus. So this is not going to work even in patients where you have operated the uterus for multiple myomectomy. This is not going to work in patient who has had past history of Asherman syndrome, past history of septal resection. In all these situation, ERA test may or may not work because the endometrium which you biopsy, let's say you have done a septal resection and the endometrium which you biopsy is going to develop from lateral epithelialization. It is not the endometrium which is going to get core vascularity from the uterine muscle. Understanding? That is the reason why ERA will not work in all these situations. So go by logic. Just remember one thing. It's a sweet test. It's a cute little thing to add in your entire thing. As madam said that, you a la carte or something. That entire a la carte of or whatever you give to your patient, it is like that cute little thing which people like to look, but it is only good to look. Understanding? Beyond that, in a practical Indian situation where you are fighting to cut down 1000 rupees cost in your protocol, don't end up adding a 50,000 rupee test, which may not even increase the success rate of your patient by 5%. Okay. So, yeah, I'm done.
Yeah, I'll just share my screen. Just for the completion sake of the class, we'll just finish it. I know you don't believe in it. Now nobody wants to see it also because you've said it's not useful. It's okay, I'll just do it. So this is how we get the tubes for the ERA test, and there will be two buffered solution here. So first we'll have to label the patient name, the date, and the time that we are doing the test. And this is the biopsy, the instrument that we get, and just rotate it. It has a suction just like a people endometrial biopsy, how we do it, and we'll have to put the tissue inside the bottles. There will be two bottles, and it's extremely important to not put too much tissue into it because the tissue has to lies in that solution that they have provided. And it is extremely important that we should shake it very well before we actually send it for testing. And also it is important that we need to refrigerate the sample for 4 hours before we send it with the person to the lab. So apart from this, yeah, so that is about the procedure of doing an ERA. I know Dr. Jay doesn't believe in it, but you said that HRT is the best way that we need to do the ERA test, and none of the other the protocols like MNC or natural cycle will not work. So do you do a progesterone level on the day that you start progesterone?
No,
You do a Doppler for the endometrium that we
no,
before you start the progesterone?
no.
So important thing that we have to note here is that the stimulation has to mimic exactly the way that we want to do the FET, right? I mean, without any changes in that. So is there any particular way that you follow that this is the only estrogen that you want to give, or not at all?
No.
Okay, and once we do the ERA, so if it comes as pre-receptive, so does that hold good for all subsequent, even if we do
Only
an
the next cycle.
only the next cycle?
Yeah, nothing beyond that.
Oh, okay. Okay,
It
okay.
is just a maximum 1 to 2 month upregulation of genes. It is not lifelong.
Hmm. And also, in these situations, like you said, in septal resection, it is lateral epithelialization and all those things. But isn't that going to stay the same for that patient even in the next cycle? I mean, we aren't going to disturb the milieu of the
But you
endometrium.
don't know which part of the endometrium will come in the biopsy.
Yeah, but the transfer also will be in the same cavity, right? I mean,
Correct. What if the genes are not upregulated on that focal point? embryo is such a small part of that whole cavity, okay, that you are trying to take a very broad picture of that endometrium and say that this is the window of implantation, which
Mm,
is why you can't do it in a natural cycle, because in natural cycle window of implantation is on an auto adjust mode
yeah,
for
yeah.
more than 24 hours.
Mhm. Okay, so there are so many companies that offer ERA. I know we shouldn't be speaking about it, but generically speaking, so is one company superior to the other? Do you prefer somebody who is offering the test at a much lesser cost? What do you think?
No,
No, not
machine is
really.
the same, madam. It is also the same. It is available in India for 4,000 rupees.
Okay. So if you said that if it is less than 98 hours or if it is more than 148 hours, then there will
That
be
means there is some mismatch.
mismatch.
That is the
So,
reason why you are supposed to repeat it.
yeah. And what about in cases where there is pre-receptive? So do you correct it and then do a repeat ERA and then do the transfer?
No, no. I told no. If it is pre-receptive, just transfer one day before. Sorry, one day late.
After. Yeah. So you don't add one more day of progesterone, repeat the ERA, and then you
Nothing, nothing. Next cycle, just transfer one day late. And then also she'll not become pregnant.
okay. Yeah. Um, So that's about it. So you think like genetically the upregulation of the genes is something which is not a
It is dependent on uterine factors, which genes to upregulate. It is also dependent on the type of microbiome. It is also dependent on the type of condition inside that particular uterus. Correct. If there is a hydrosalpinx in the fallopian tube, your ERA test is gone, fired. You are not going to get any proper upregulation, which is why I am saying it has to be a normal pelvis.
Mhm. No, see, for that also, see, many a times we have this peritoneal endometriosis, or we
Yeah,
have situations where,
you will not get a proper ERA test in all that.
but see, nowadays, so many patients themselves come asking for the test, saying
No
that,
problem. Patients have information. It is your duty to give them knowledge.
okay, yeah, okay, thank you. I think we are good. So, uh, yeah, that's about it, I think. Thank you so much. I know you must be like, I mean, exhausted with so many surgeries in Dehradun. Thank you. Thank you for
Get to
your,
one more class if you want.
thank you.